Knowing the instruments in any setting, whether you're in a general office or any kind of a specialty office, is going to be important. That's why we spend some time having you kind of determine what type of instrument it is and also what its purpose or function is for, because we deal with instruments all of the time. So this would be considered a basic trace setup for a routine simple extraction. Aside from our basic setup, which would consist of our mouth mirror, our explorer, our cotton plier, and oftentimes our perio probe, and also the instruments and material needed for the anesthetic, which would consist of the syringe, our anesthetic cartridge, our needle, and of course our topical anesthetic. This is the instruments that we would need to extract a tooth. Just kind of go over a little bit of information over each of these basic instruments. So here, number one, we have the periosteal elevator. We know it's a double-ended instrument. This here would be the handle. This area here would be the shank. And then, of course, the area that we're going to be putting into the mouth and that's going to be doing the work is called the working end. So this is what instruments consist of, and all instruments are the same way. Some are double-ended and some are only single-ended. So the periosteal elevator would kind of be used initially to sort of break away the periodontal ligament that is surrounding the tooth. So the dentist or surgeon is going to be using that usually initially just to kind of break away that ligament to make it a little bit easier to remove or extract the tooth. Next, we have our elevators, and these are our straight elevators. And they do kind of what their name says. If you haven't noticed already in dentistry, oftentimes the names of things are kind of as to what they do. So elevators are no exception. So these are our straight elevators, usually consist of a small and a large, and it's usually determined by the size of the working end right over here. But these straight elevators are going to be used to sort of help to elevate the tooth or the roots out of the socket. What my dentist would do all the time is once he took the periosteal elevator, went around the tooth with it, he would then take the forceps, which is this one right here, and he would actually luxate the tooth. And what he would do as he luxated is he would basically wiggle the tooth, and he would wiggle it for about 5 minutes. He would let it sit and then leave and go into his office for about 10-15 minutes and then come back, and we would start the process of extracting. His thought, which seemed to work most of the time, is that it would increase the blood flow to the socket, which would help to sort of lubricate the area, which made extracting the tooth a little bit easier. So that was just a trick that he would do prior to any kind of extraction, if it was going to be a routine or simple, that we were able to use a forceps on. So forceps is going to be used for those teeth that we can actually grab a hold of. Anything that's broken at the gum line, we would not be able to use a forceps. We would then have to use strictly elevators to help to elevate those root tips out of the socket. So this would be a forceps. Next, we have our curette, and our curette can either look like this with a larger handle, or it could look as a double-ended, very similar to this. And unlike the periodontal curette that is used to remove calculus, the surgical curette is used to, once the tooth is extracted, is to sort of scrape or remove any debris that might be present in the socket. And also it makes the socket bleed, which we want that to happen, because we'll talk about what happens if the socket is dry in another video, but that's very important to do after an extraction, is to make sure any debris is out of the socket. Definitely gauze is very important because we're going to insert gauze into the patient's mouth. They're going to go home with the gauze. in their mouth, and that's important for us to have several out, not only for that, but to wipe off our instruments if need be, to grab the tooth if need be, but gauze is going to be very important. And then we have, which may or may not be on some setups, is your tissue forceps. It resembles the cotton pliers, except instead of it being curved at the ends, it is going to be straight. And that just allows, if we need to, hold the tissue away or something like that, it just helps us to get a better grip of the tissue without injuring it. So this is going to be kind of your basic setup here. Like I mentioned, for more of a routine, simple type of extraction, if the extraction is going to be of an impacted tooth, then obviously we would need more instruments onto our tray. We would need our scalpel, we would need our blade, we would need sutures, and possibly other types of instruments as well. There are lots of different types of elevators that are out there, and there's also many types of forceps. We have forceps specifically for maxillary, and there's going to be forceps specifically for mandibular. So how to remember what's going to be maxillary and what's going to be mandibular. This will come in very handy. What you will know with instruments that on the handle, usually along one of the sides down here, along here, is going to be a number. A lot of times surgical instruments are going to be identified by a number and not necessarily their name. Again, it's going to depend on your dentist. But how can you remember what's going to be used for maxillary and what's going to be mandibular is how it's shaped. So anything that is S-shaped, I-shaped, or Z-shaped, if you turn the instrument, is all going to be maxillary. Anything that is going to be C-shaped or L-shaped is going to be used for mandibular. So I want you to kind of remember this little tip and trick. It will come in very handy when it comes to having to pull out your instruments depending on what tooth you're going to be extracting. To remember S, I, and Z for maxillary, and C and L for mandibular.